Hi, my name is Robert Whitten. I'm editor of Employee Benefit Advisor, and today we're Janet Trautwein, Executive Vice President and CEO of the National Association of Health Underwriters. Janet, thanks for taking a couple minutes with us. You just testified. We're going to ask you a couple of questions about the testimony. First one being that in the beginning, when you presented your testimony, Chairman Andrews, one of the first questions, was pretty aggressive, asking you to somehow explain for or provide funding for any additional costs your proposals might add to the system. It didn't seem like you had specific recommendations. What was your feeling of that exchange?
Well, it was an interesting way to start a hearing. You sort of start a hearing like that and you feel attacked immediately because the things that he recommended were issues that are not really related to things that we work on. It was an uncomfortable situation. I think one of the reasons why he came out of the box with that is because we have been so vocal lately on opposition to a public program. In the last 2 weeks, we've had 25,000 letters to the Hill come in opposition to that, and I think it has caused some agitation around here.
One follow-up question to that is, it seemed like he was really concerned that anybody suggesting that we spend more money have a way to pay for what we're spending it on. NAHU, have they articulated what they would like to spend more money on?
We've talked about things like pay for performance, evidence-based medicine, wellness, and prevention, and things that will actually bring down the cost of healthcare. Electronic medical records. The latter part of the discussion today was about electronic medical records. No one talked about interoperability with all these great records that we're creating, and the ability for them to talk to each other. What good are they if the hospital can't see your doctor's records? And so these are things that would get rid of duplicative procedures in the system and actually improve patient care and reduce costs at the same time.
Another aspect of the hearing, one of the representatives brought up insurance companies. There was a question put to the panel, what value do insurance companies bring? I think it was focused on the individual patient. I guess there wasn't a lot of opportunity for response to that. You as CEO of NAHU, you have actual insurance company health underwriters as part of your membership. If you could respond to that question now, what value do insurance companies bring to the healthcare system and patients individually?
Well, insurance companies are financing the health care of America. We may disagree with how they allocate costs, but that's how people get covered today, is through insurance companies and other employer-sponsored plans. And I think it's just the wrong target.
What's the next sort of thing you're looking for in this healthcare reform discussion? You testified today. What's the next thing on your account?
We're working a lot in some of the stakeholder groups that are on the Senate side, where there's a little bit more of a more calm discussion about what the issues are, a little bit more of stakeholder input from all areas. And I'm actually enjoying those discussions a lot more because I think we're making some progress. I doubt that we will get everything we want, but we're looking forward to that. We're also very watchful of the reconciliation process to make sure that relative to that Senate vote, we are going to need the 60 votes to get it passed as opposed to 51, that's what it would be if we did the health care through reconciliation.
Fantastic, Jen. Thanks so much for your time.
Sure.